So, let's talk about something that comes up a lot for women considering hormone replacement therapy, or HRT. There's this one big question that's on a lot of minds. Could it actually cause or, worsen ovarian cysts? It's a totally fair question. And today, we're going to unpack the evidence, and the answer might really surprise you.
Okay, so here's our game plan. We'll kick things off with that big question about HRT. Then we'll get on the same page about what's this actually are before diving into some really surprising research. After that, we'll look at how modern HRT is managed and wrap up with why letting evidence, not fear, lead the way is so important.
All right, first up, let's get right to it. We're tackling that big question head on. Because look, when you're thinking about a treatment like HRT, you want to have all the facts, right? This is a concern we hear all the time. And here it is, the question that's probably on your mind. Can a therapy that's supposed to help with menopausal symptoms end up creating a whole new problem? Okay, so before we can really answer that, we've got to get the fundamentals straight. Let's make sure we all know what we're talking about when we say ovarian cyst. At its simplest, it's just a fluid-filled sac that can form on or inside an ovary. The definition itself is pretty straightforward, but the context, like when in your life they show up, well, that changes everything.
And that context is so crucial. See, before menopause, cysts are often just a totally normal part of your monthly cycle, and they usually go away all on their own. But after menopause, it's a different story. New cysts are way less common, and when they do appear, they are almost always small, simple, and totally benign. That difference is really the key to this whole conversation.
Okay, now that we've got that foundation, let's get to the real heart of the matter, the surprising evidence. This is where things get really interesting because we're going to look at what the research actually shows. So, remember that fear we talked about? The one that says HRT might cause or worsen cysts? Well, what if that whole assumption is just wrong? Seriously, the data we're about to look at might completely flip your perspective. Okay, check this out. This is where it gets absolutely fascinating. Take a look at these numbers from a study. For postmenopausal women who were not on HRT, about 28% of them had cysts. Now look at the women who were on HRT. Only 10%. That's right, the group taking hormone therapy actually had fewer cysts. Pretty counterintuitive, huh? And it gets better. The research also tells us that even when cysts do pop up in women on HRT, they're almost always harmless. They're called functional, which basically means they're just a response to hormones, not a sign of disease. They don't cause symptoms, they aren't cancerous, and they're usually just something to keep an eye on, not to treat. So that probably leaves you wondering, why does the data look like that? And how exactly is modern HRT managed to keep everything safe? Let's dive into the why and the how. Well, the secret is really in the design of modern HRT. See, it's not about just flooding your body with hormones, not at all. It's about using really controlled, careful doses. It often combines estrogen with progesterone to keep everything in balance, and the result of this careful approach is that if any ovarian stimulation happens, it's super minimal, and any cysts that might form are typically tiny, harmless, and temporary. You also hear a lot about bioidentical hormones these days. And what's cool about them is that they're chemically the exact same as the hormones our bodies make naturally. The big advantage here is that they allow for super individualized dosing, which can be even gentler on your body's tissues. And this is so important. Managing HRT is not a one-and-done prescription. It's an ongoing partnership with your doctor. A good, responsible plan, like you see here, involves things like regular monitoring, really paying attention to your symptoms, keeping the lines of communication wide open, and being ready to tweak those hormone doses if needed. And let me just add this final piece of reassurance, because I know the word cyst can make people immediately think about surgery. The reality is, surgery is very rarely needed. It's really only on the table if a cyst is getting big, if it's sticking around for a long time, causing pain, or if it looks complex on an ultrasound. Okay, so let's pull all of this together for what I think is the most important takeaway of all: the importance of choosing evidence over fear. So what's the bottom line here? What have we learned? Well, first, the evidence is pretty clear that for most women, HRT does not make cysts worse. Second, finding a simple cyst isn't some automatic red flag that means you have to stop therapy. And third, and maybe most importantly, the whole thing works best when it's tailored to you and monitored carefully. And this really says it all, doesn't it? It is so easy to get caught up in the what-ifs and anxiety. But making smart, informed health decisions is all about looking at the actual data. When it comes to something like HRT, you've got to let the evidence, not fear, be your guide.
And this way of thinking doesn't have to stop here. It kind of leaves us with one final question for you. What's the next health conversation you're going to lead with evidence? Thanks so much for joining me for this explainer.